Today we're going to continue the conversation on how our muscle and joint health affects our overall longevity. Let's define mobility in this sense as the ability for you to move through ranges of motion in order to do the activities that you need to do or enjoy doing. Now, the inherent problem here is that many of us in modern society, we sit for work, or we're spending a lot of time commuting in the car, or life busyness just doesn't allow us to get enough movement in throughout our day or enough workouts throughout our week. And that has adverse effects on our body and on our mobility overall. Hi, I'm Dr. Zach Ratliff at TruMotion Therapy here in Charlotte, North Carolina, where we specialize in the conservative management of musculoskeletal pain and injuries, which means that our treatments don't entail the use of surgery, drugs, or long-term care plans. Compounding on the problem I mentioned earlier, if we lack mobility now, that's only something that's going to amplify or worsen as we age. So it's important that we use that motion. Otherwise, this is a case where if we don't utilize that motion, we are going to lose it. Now, think about mobility training as a way that we can regularly and methodically take inventory of how much movement each and every one of our joints has. One way of saying this is we often get injured in positions that we weren't prepared for. So a lot of our everyday activities, we just don't use kind of the max range of motion in our joints. But throughout our life, we do get challenged in certain movements, often suddenly. So think about when you're playing recreational basketball at a local gym, or returning a tennis serve as you get a little overextended, or you suddenly see your toddler's about to fall out of a chair and you make a quick movement in order to kind of intervene. These are going to be examples where you surprise your body by getting into that position. And if we're not regularly taking our joint to that range of motion, the body might perceive that as a threat. It could go into kind of a protective spasm, or sometimes it can cause some injury as well. So this is why mobility training is so important, to build that kind of brain-body connection so that your brain has kind of a mapped out inventory of available motion. And then that's going to improve our balance, our stability, and just our overall coordination. Now, as we've been talking about longevity and how it relates to muscle and joint health, we've talked about strength training, we've talked about cardiovascular training in those. Mobility training is going to be the thing that enhances both of those. If we have adequate mobility, we're going to be able to get a lot more out of our strength training and our cardio training. So in kind of practical terms, think of this as influencing movements like a squat. That's going to be you sitting into a chair. Consider a movement like a deadlift. This is you picking something up off the ground. Think about an overhead press. This is in your everyday, this is maybe you picking up your grandkid and lifting them over your head. So these movements are going to help your everyday life, but also enhance kind of your specific movements, say in the gym, of trying to add hypertrophy training or just overall strength and the lean muscle mass that we've talked about previously. So to sum all of this up, if we take care of our joints, they will take care of us by allowing higher function and greater ability to do the things that we love, especially as we age into our older years. Now, if that is something that you're struggling with, if stiffness or pain or anything else of that sort is affecting your life or your ability to do activities that you find meaningful, that's where we come in. So I would invite you to check out our website at TruMotionTherapy.com, where we have more resources, we have more videos, as well as the ability to schedule an appointment with one of our providers. And we would love to take kind of a thorough look at everything you've got going on, how things are affecting one another, and we can make a great treatment plan to help get you back doing all the things you love, and just high function for the long haul.